Your mom has early Alzheimer's, and honestly, you're not sure if she'll fit in an assisted living or if she needs memory care. All you know is that she's no longer safe at home. Every tour you go on talks about how they won't know where she fits in either until she has an assessment and a cognitive test. You know the word test is going to totally freak your mom out. So, what is this test all about? I'm your host, Valerie Lynn, and this week we're talking about the mini mental. Welcome to Desperately Seeking Senior Living, a podcast for sons, daughters, grandkids, and spouses who suddenly find themselves tangled in the search for senior living and care. If you like today's episode, don't forget to subscribe and check out our doable download in today's show notes for a printable summary of the show and a bonus tip. You're listening to our doable tips, short answers to your questions. Don't see your question listed? Send us a note. Then don't forget to subscribe so you never miss an answer. Hi, and welcome to the show. I recently had a client face this exact situation. Their mom definitely has memory loss, but she's cognitive enough that they wanted to prepare her for this upcoming community assessment. So they told her what to expect. But all she could focus on was this test. What would it be like? Was she going to pass? Would they let her in? Another client of mine was so nervous, and it was so hard for the family to not jump in with the answers. Come on, mom, you know who the president is. So, today we're going to talk about what's on this cognitive test, most often called a mini mental. I know, it sounds terrible, right? Well, it's technically called the Mini Mental State Exam, or MMSE, also known as the Folstein test for its creator, Dr. Folstein. And on a side note, there are so many other cognitive tests that may be shorter, they may have different questions and different names, such as the MSE, the Mental Status Exam, or the Montreal Cognitive Assessment, or the MIS, Memory Impairment Screening. Your mom's doctor or the community you're interested in might use a different test, but today we're going to focus on the MMSE, which will give you a general idea of all cognitive testing. We're going to talk about what's on the exam, the scoring, and how it's used by the community. And I'll have a link in show notes to more information. The test is comprised of 30 questions, and they range from memory questions, orientation to place and time, repetition, attention to detail, language, and even drawing. The questions generally start out easy and then get more difficult. For example, it may start with, what's your name? What city are we in? What day is it? What year? Who is the president? And then they'll be asked to remember 3 items. Several questions later, they're going to be asked to repeat these items. And honestly, that's a hard one for me. The more complex questions may include drawing a specific time on a clock and finally drawing a complex shape such as a pentagon. And if you're anything like me, you may be sitting there right now trying to remember how many sides are on a pentagon. The test isn't looking at one particular question, so it's absolutely okay if you can't remember how many sides. Let's look at the scoring and what it generally means. If your mom scores 25 to 30, meaning she got 25 to 30 questions correct, that's considered normal. Below 24 is generally considered abnormal. And more specifically, 21 to 24 is considered early or mild cognitive impairment. 10 to 21 is generally considered moderate, and 0 to 9 severe. So, what does this scoring mean to you and a senior living community? Well, first of all, it is not foolproof. This is a very basic scale. And not only is it very basic, but if you Googled scoring the MMSE right now, you would most likely get variations on what levels of cognition correspond to what numbers. You're going to find different numbers and ranges than what we just talked about. But if you're in a situation where someone is administering this test, then chances are you're not going to be surprised by the findings. You are most likely already aware of your loved one's cognitive decline. but a community may use this information to help you and them determine if your loved one is okay to try assisted living versus a secure memory care. If your loved one scores below 15, they may be a better fit for memory care. But again, this is going to be based on other factors, and every community is different. Now, I want to go back really quickly to the family that decided to tell their mom about the test. Should you tell your mom or dad about this test? Well, it really depends. Is it something that they would stress out about, focus on, or lose sleep over? While I can't guarantee anything, the test is generally administered in a very easygoing way. And sometimes you don't even realize it started. So, this is something you'll have to decide for yourself and your loved one. And you probably know the answer. If they usually focus and stress out about things like that upcoming doctor's appointment, where they're always focused on what time is it? What day is it? Is it time? Is it time? Then maybe it's not a good idea to tell them. So, is your mom just forgetful? Is it old timers? Or is it something more? While there are currently FDA approved tests that can determine if someone has Alzheimer's, they can't help us determine if someone is safe alone at home or if it's time to consider a memory care community or in home care. And sometimes we just want a definitive answer so that we don't feel so alone in making these really tough decisions. This test is just something to add to your toolbox, something that can hopefully make this journey a little more doable. Today's episode is brought to you by ClearPath Senior Living Solutions. ClearPath helps families find assisted living, memory care, and other resources. Find our contact information in today's show notes. Check out this episode's doable download in show notes for details, including industry terms and definitions we discussed, as well as a bonus tip from our guest. Have questions or your own tips to share? Leave us a message. We'd love to hear from you. And until next time, make it doable.